Tony Stein is Chief Executive of Healthcare Management Solutions, which operates about 70 care homes across the UK. Welcome to you. What do you think?
Good evening, Eddie. Yes, I think it's great news, to be fair. The residents and relatives have had 2 years of very difficult separation. We have had this situation of rolling lockdowns, and to have some relaxation now is very, very welcome. Clearly, we still have to risk assess situations, but, we also have to follow guidance. So if the guidance tells us we have to do certain things, then we have to do that. So the fact that that's been relaxed gives us a lot more latitude. And it's really important that people get to see each other. Really, genuinely, distressing when you've spent the last 2 years of not being able to see your loved ones.
And what about the rolling lockdowns that Kate also mentioned?
Yes, well, the fact that they're shortening the period to 14 days if we've got an outbreak is going to help. But quite right, this situation in a lot of care homes has been that we have had these rolling lockdowns. And, whilst we may have a view on that, we have to follow guidance. There's no question about it. As operators, we really have no choice. That's what we do. That may start to relax a little bit with the shortening of the isolation period.
If you were writing the guidance, what would you write?
In fairness, we probably wouldn't be far away from what we're doing now, but we probably would have been a little bit ahead of it. What we've seen with a lot of the positive cases that have caused us to close our services is, as most people have seen, that these positive cases are not actually with people who are ill. We've had a lot of positive cases through the staff workforce, and that very, very, very few people have actually been ill with this particular variant. So, I think it was fairly clear to us a short while ago, a few weeks ago, that this Omicron variant was perhaps less aggressive than the Delta variant was. And so we may have been able to do this a little earlier, but, let's just be happy that we've got a little bit of relaxation now, and we can start to work within that.
And just finally, what about your staffing levels generally? We were talking in our first hour about planned changes to universal credit, trying to get people into all sorts of work. How are you getting on recruiting people?
Well, as with everybody in the care sector, it's very, very tough at the moment. And we've, like a lot of operators in some homes, had to choose to close our doors to new admissions simply because we couldn't staff up to meet those extra people coming in. It's a difficult one. I mean, I personally think that caring for people is a wonderful thing to do, a very rewarding job. It's not for everybody. We should value it much more highly. And I think we've got to find ways of paying people commensurate wages for doing what is a very responsible and very worthwhile job. And that's probably the difficult one. I think there's many people who probably want to do this as a job, but just can't afford to because it just doesn't pay enough. And of course, that's not a choice that operators have, where a lot of us are dictated, the fees that we're paid are dictated to us by the local authorities, so we can't increase our fees to pay our staff more. So it's quite tough. But we've managed. We've obviously put in place contingency plans for if our staffing levels drop. So far, touch wood, in most of our homes, we've managed to struggle on, but that's putting extra pressure on the staff that are there. So the idea of people isolating for shorter periods of time will definitely help.
Thank you for talking to us. Tony Stein, Chief Executive of Healthcare Management Solutions.